Thanks for your company. The details now. One medical officer in the Karachi East municipality attends to over 15,000 patients in a year. No administrative block and vehicle, one ward for all sexes. That's the reality at the Dambai Health Center in the Karachi East municipality. The senior medical officer there, Dr. Mrs. Abigail Mausi-Quist, suggests these conditions are affecting quality health delivery in the area. Correspondent Peter Seno has more in the following report.
Grounded vehicles, no administrative block, with just one medical officer in the whole municipality, with a few auxiliary staff responding to over 14,000 clients in the Karachi East municipality, which also serves as the OT regional capital. With Urara Government Hospital currently serving as the regional hospital, which is an hour's drive away, referral cases from the Dambai Health Center have become a challenge. The other nearest facility is in the Karachi West District. Anova Bank is also an hour's drive away. These unfavorable conditions, Dr. Mrs. Abigail Quist says, are affecting quality health delivery in the area.
Currently, we don't have a hospital in the whole of the municipality. In fact, this is the only big facility we have, and I'm the only doctor in the municipality. So I think upgrading this place into at least a polyclinic before the regional hospital comes will go a long way to support the people of this municipality. Right now, we are in dire need of infrastructure.
The Dambai Health Center also has one ward for all sexes and ages. This, the medical officer says, is not the best and a challenging situation for them at the center.
But just one ward that admits both children, females and males. There's an old structure that is being renovated by the assembly, the Karachi East Municipal Assembly. They haven't handed over to us yet, so we are really grateful to them. But that we still need more because the numbers are growing. Yes, it's a big challenge. It's a huge challenge. Of course, at least there should be a segregation between the children, the males and the females. But we don't even have that at all. So when you're offering your services, it shouldn't be done anywhere like that. Of course, the males should be separated from the females. So that is a very big challenge. So if we can get more of such structures so that the males are seen separately, the females are seen separately, so that they can have some privacy.
She also reveals 2 of their vehicles are grounded and there is no official vehicle for administrative work and for outreach services.
We don't have a vehicle at all. Yes, all our vehicles are broken down. So coming to work is a bit of a challenge because my house is quite far. I'm not resident in the facility premises, so I have to travel all the way to work, which is a big challenge. So if you can get a pickup for the facility. Now, our regional health directorate is in Rara. So when we have to go for medicines and other things from there, going on outreaches is a big challenge. So I think it will benefit us a lot if we can also get a vehicle.
The senior medical officer made the remarks in an interaction with JoyNews after she received 2,700 pieces of face masks from MTN Ghana. MTN says they are only augmenting government efforts at combating the coronavirus pandemic.
MTN being the number 1 telco in the country, we feel that we should support, as part of our social responsibility, we should support the society with this pandemic that we are being faced with to ensure we all do away with this pandemic. We came here today to support Dambai Health Center so that the frontliners can attend to their patients who have been affected with this pandemic. This is a national thing we did, and the company decided to break it down to the district level. So this is something we are doing it nationwide. And with the team at Volta North, we went to Jessica, and we are now here at Dambai Health Center.
Peter Senu for JoyNews.
Now, in every election year, there are battles for the voters' thumb. This year, your election headquarters is redeploying boots on the ground for our new show, Battleground. This show brings the microphone to listeners of Superstation Joy 99.7 FM and, of course, our audience here on Joy News in carefully selected constituencies every Thursday, and the show airs at 8 p.m. on Joy FM. Here's something to tease you ahead of the premiere today.
The Adentan constituency will on December 7 see a keenly contested race. The MPP's Yaboabian Samoa will be seeking to make history as the only MP to be retained.
A bigger gap a bigger gap. In 2016, I had nothing to show. Now we have lots to show. We have a lot of things that have happened in mere 3.5 years of the new Patriotic Party's governance in Adenta, as compared to the 8 years that the NDC had in Adenta.
Yes, sir.
And we believe that, given the differences, residents of Adenta will feel the edge to maintain the MPP in power.
The NDC's Mohammed Ramadan will want history to remain unchanged as he maintains Yao Boabin Asamoah does not deserve a second term.
If with the help of God we've been able to go through this one, I'm very confident that come 7th December 2020, Ramadan will be declared the winner and Member of Parliament elect for Adenta constituency.
The constituents who are politically conscious simply cannot wait. At the bus terminal on a Thursday morning, the usual political debate is already underway. I join and ask who will win the seat in the upcoming election.
MPP supporter, but Ramadan and a winning.
Meters away from the central part of the terminal, I meet Ayisi and Big Joe. Big Joe, a driver in his early 40s, is the first to speak. He's clear in his mind that the current MP, Yao Boabin Asamoah, does not deserve his vote.
It is not going well at all, because at the time the NPP was taking over government, we thought they would do things differently. You should see the route we the taxi drivers use. It is in a terrible shape and impossible to use once.
Big Joe's friend, you see, has a contrary opinion. He insists Yao Boabin Asamoah deserves a second term.
They are telling lies. We are not losing. Things are cool here.
So that's just a teaser of what to expect at 8 p.m. tonight on Joy 99.7 FM. Our host of the show, Emefa Apawu, joins us to tell us more. Hi, Emefa. Now, you are the commander-in-chief of the battleground. Why is this show...
I'm doing battle tonight with the team, the crack political team, and I look so forward to it. It's the battleground, we call it. And you can see already that the head of our political desk, Evan Spencer, my colleagues, Kojo Yang Elton Brobe, we'll have Joseph Akable, Winston Amwa, Daniel Dati, the entire team will be joining me tonight on Joy FM at 8 p.m. And guess what? We're going to Adenta. You've just seen snippets of it already. Guess you're looking forward to more. We'll also have the two contenders. We say battle, but of course, it's not a battle literally, but it's a battle of ideas, a battle of who gets the attention of the constituents of Adenta constituency. And that's what we say when we say we're doing battle. And that's how it's going to go down tonight. Dennis, I'm sure you're looking forward to it.
Definitely.
You pass it as well.
But Emefa, tell us why this is important. Why do we need to have a battle of ideas, as you put it?
Well, you see, most of the time, our politicians tend to take the constituents of their area for granted, those who voted for them. They are battling for their thumb this time around. But the past 4 years, what has it been? Did they take them for granted? Did they say they would do what they would do? Did they actually do what they promised to do? We know that MPs are not supposed to be undertaking projects in itself for them, but they are supposed to be lobbying. They contested and told them that they will lobby for roads, they will lobby for water, they will lobby for all the projects for them under their manifesto. And this time it is Yao Boabin Asamoah, the communications director of the MPP. Now, he gave a number of promises under the MPP's manifesto. Did he deliver on them? Are the constituents satisfied with what he has done so far? Is it time to also give the opportunity for the other contender, or they will retain him based on the things that he has done? So we need to hear from the constituents themselves so that we stop taking those who vote for them for granted. And that's how come we're doing battle, the battle of ideas, the battle of who retains the power, or if it is a time for them to change them. And that's what this is about, not just the battle literally like people have thought about. So that is what we say when we are doing battle. So we are looking at the voter dynamics of the Adenta constituency. Each constituency we go to, we have only about just under 2 months to go for election 2020. Unfortunately, we can't go to all the constituency in the country, but we know the hotspot, where all the action will be. So in the Greater Accra region, that's where we are starting from. And where else to start from? People were expecting we do from Odododio. But Adenta is a very interesting area that people have not paid attention to. So if you join us tonight, you'll see why we are starting from the Adenta constituency.
So what form will it take, MFR? We know that you would play what we just heard of some constituents sharing their thoughts. But tell us generally what form the 1 hour program will take.
You haven't heard enough just yet, Bernice, because the people of Adenta have some interesting things to tell us. So we have, we've heard from some of them, and we'll have a longer version. You hear from other people from the area, those who are, you know, just sitting on the fence, hoping that they will be, you know, convinced by the two. So we'll hear from them, and then also the MPs themselves, the MP himself, as well as the contender for the NDC will also join us tonight. And of course, the team that I have just told you about, the head of our political desk, Evan Spencer, will be on. Joseph Akable, who was on the ground as well, who is the lead producer of the Battleground, will also be on to give us the dynamics of the area. Winston Amwa will also join us, Elton Brobe, of course, and then Daniel Dati, and then Kojo Yankson, the Super Morning Show host. They will all be on. Today is a political Thursday on the Super Morning Show. He's had enough. He will come on. He will come on with all the dynamics as well.
Sure.
And it's all centered on the Adenta constituency.
We will definitely join you, Commander-in-Chief of the Battleground, MFR Pau, and your team for the premiere of the Battleground tonight.
We'll be on Joy 99.7 FM. We'll also be on all our social media platforms, myjoyonline.com. It's a good time to also join us. We'll give you the opportunity also, those we didn't capture in the video, we will give you the opportunity live to also join us much later on the show tonight at 8 p.m.
Thank you very much, MFR Pau. There is going to be an intense 1 hour from 8 p.m. to 9 p.m. On Joy 99.7 FM. This and many other reasons why you should stick with us when it comes to election-related matters. This is your election headquarters. Let's do some other stories now. Today is World Patient Safety Day, and issues of access and quality largely contribute to ensuring patient safety. President of the Coalition of NGOs in Health, Dr. Gabriel Benaku, is my guest for a conversation on this subject. Thank you very much, Doc. It's a pleasure to have you here. So when we started the bulletin, we shared a story from the Volta region, somewhere where over 14,000 people have access to only one health facility with only one doctor. We are here today in Damba in the OT region, I beg your pardon. We are here today celebrating World Patient Safety Day. How do we ensure safety in this kind of situation?
Yeah, thank you, and good morning to people who are watching you and listening to this program. Yes, that is why Ghana is continuously developing the policy over the last 20 years. We need to address that. And we keep on telling government that they need to do something about it. If you look at OT and the 6 regions, that is the Bono East, the Savannah, the Northern region, the Northeast, the Upper West, the Upper East, they are very much vulnerable, and Western North. These are the regions that we need to really do something about it practically. They are mostly affected by inadequate doctors, inadequate nurses, and even more importantly, they do not have standard district-based hospitals. And if we want to ensure safety of patients, we need to have a universal policy and really implement the policy to ensure that every district have a district hospital. We need to ensure that nurses are placed at the various CHIP compounds. Community health nurses and other paramedical teams are supposed to be accessible at the primary level of health service delivery. Most of the issues we deal with at regional hospital are actually supposed to be dealt with at the district and even polyclinic level. but because we have not equitably provided infrastructure and human resource, people have to struggle to move from primary, secondary to referral facilities. And that also creates more pressure there. So the specialists who are supposed to work on special cases tend to just deal with normal malaria cases. And they get overwhelmed with the cases, and therefore they get frustrated. They could make some mistakes. And we have seen over the last, before COVID, we used to have almost every month, we have negligent, alleged neglect, medical negligence cases. That tells you how our health system is overstressed at the secondary and tertiary level.
Doc, is
so
it?
We want to take this opportunity to encourage the two major political parties in these difficult times to really come out with pragmatic and practical manifestos that can really ensure that there's universal access to healthcare at the barest minimum level.
Doc, it's interesting you mentioned fatigue as a factor in patient safety, because when a doctor is stressed and tired, then they're likely not to do what's best for the patient. There are 4 objectives.
No, they even make mistakes. They can make mistakes.
Yes, there are 4 objectives for this year's World Patient Safety Day. One of them is to create awareness about safety for health workers and how it links or translates into safety for patients. Do you think that we pay much attention to safety for health workers as we do for patients?
No, even health workers. I have researched over the last 6 years with health facilities. I've collaborated with specialists in health facilities. I've worked with the Mental Health Authority over the last 10 years. And what I do know is that even health professionals get depressed. And sometimes they are not even aware that they are depressed. And they just need to talk to a clinical psychologist. They need to talk to a mental health officer. They need to talk to a psychiatrist to also provide some services to them. And that issue is a major issue in Ghana. You see a lot of health professionals, but they do not have mental health knowledge, but they are not ready to seek for those services. So we are taking this special day to remind them that people who are trained as mental health officers, psychiatrists, and clinical psychologists also have that special eye and skill that can help them to cope with stress, anxiety, depressions, and for them to be able to do their work well. Because every day they get stressed up in their workplaces due to inadequate human resource, due to inadequate facilities. So they are forced to do so many things at the same time. The other issue I would like to talk about is accident cases. We actually need a psychologist or a clinical psychologist who should be part of the National Ambulance and Paramedics team to provide psychosocial therapy during accident, to provide interventions that can really calm down people when they are affected by accident, including families. It has a major effect in our healthcare service delivery. The other point I would like to talk about is our inability to fund the mental health authority adequately so that they can be found in every district and they can provide major education to health issues that people get stressed up. They can provide psychological medicine to reduce pressures at the various health facilities. It's very important for us to do that.
Doc, one of the reasons celebrating this year's World Patient Safety Day is very important is because of the coronavirus that has hit the world over. Now, like I mentioned, it's World Patient Safety Day, but the WHO, due to what coronavirus has created, has decided to also focus on the safety of health workers, and it's actually urging all to speak up for the safety of health workers, because that also directly translates into patient safety. As we commemorate the day, you've made a call to the major political parties, but let's look at the entire system and stakeholders as a whole. What would your desire be in speaking up for the safety of your colleagues and yourself?
Yeah, one critical thing I would like to talk to social workers like me and medical sociology like me and others is for us to advocate for improved health systems in the country, including human resource deployment. The other point I would like to talk to my colleagues psychologists is we need to have more clinical psychologists in all the districts in Ghana. We have very few. In fact, we have very, very few. So we need to work out to advocate.
Hello, Doc, are you there? Oh, too bad. We were just getting Doc's thoughts. Okay, I think we have him back. Hello, Doc.
For clinical psychologists to be deployed in all health facilities, we need to, health workers need to speak out objectively and advocate for improved health systems in the country. And also, we need to have professional health associations to be able to provide evidence by
we're losing Doc there, unfortunately, but Dr. Benako is president of the Coalition of NGOs in Health, and we'll just take his comment and then comment briefly. Hopefully the line will be stable this time. Well, too bad there, but we were just discussing World Patient Safety Day, and as I mentioned earlier, the WHO has decided that the focus this year should be on the safety of health workers and how it translates into the safety for patients. And they are urging all of us to light up buildings, wear orange, do something just to show respect for our health workers, even amidst the COVID-19 pandemic. Now, some survivors of last year's floods in the Upper East region have moved into new homes constructed for them by the Ghana Red Cross Society in collaboration with the Swiss Red Cross. The humanitarian organizations decided to come to the aid of the worst affected victims after the floods last year killed at least 29 people and displaced hundreds. Correspondent Albert Sorry has more.
Floods have become an annual disaster in the Upper East region. In the year 2019, the impact of the floods was one of the worst ever experienced in the region, as thousands of people lost their properties, hundreds lost their homes, and 29 people were killed. Following that disaster, the Ghana Red Cross Society, in partnership with the Swiss Red Cross, decided to come to the aid of the worst affected victims by reconstructing their homes for them. A total of 102 units of two-bedroom houses have now been handed over to victims of the 2019 floods. The beneficiaries are from 6 communities in the Busa North District and the Kasna Nankana municipality. The communities include Manyoro, Natugunia, Chuchuliga, Kasa, Silinsi, and Bilinsa. At a deba organized to officially hand over the buildings, the national president of the Ghana Red Cross Society, Kwame Jima Ekwafo, said the building project, christened the Owner-Driven Shelter Project, did not only seek to replace the houses for the flood victims, but also to build houses that could withstand torrential rainfall.
Every beneficiary got 350 pieces of blocks. Then about 816 gallons of bitumen. This was used for the plastering. Then we paid for the services of carpenters and masons, then as well provided for sand, stones, and cement for concrete works on the foundation. The roofing materials, nails, wood, etc. The binding wires were as well supplied by the Ghana Red Cross and the Swiss Red Cross.
Each house has a concrete base, mud walls plastered with bitumen, and aluminum roofing. Thomas Okola is the country coordinator for Swiss Red Cross.
We will continue carrying these learning from each project to ensure in case we have a third project, we are able to be more efficient, at the same time reach out more community members. We also experience capacity that has been developed both in the community and within our own organization, Red Cross.
Each of the 103 houses will shelter a family. Therefore, an estimated 600 vulnerable people who were homeless after the floods last year now have decent roofs over their heads. The wall behind me is what is left of my old house, which collapsed during the floods last year. I am grateful to Red Cross for the new house they built for me and my family. God will bless them for their efforts. The paramount chief of the Mayoro traditional area, Per Dr. Pwakia Atupari Manchi III, commended the Ghana Red Cross Society and their partners for the intervention.
I am of the view that dignity is important. If you have food to eat, you have no place to lay your head. It's still a problem. It's still a dignity question. If you have a pair of trousers to wear, you have a shirt, even you have a cap, and you still don't have a place to lay your head, it's still a problem.
Let's do something on a national science and maths quiz. Now, quiz mistress for the preliminary stage, Gladys Schwinger, says she's expecting more competitive contests as the competition continues in the Volta and Uti zone. Some of the top schools in the Volta region, Bishop Herman College, Ola Girls Senior High School Ho, and Mauli School are all battling for a place at the 1/8 stage of the competition.
Could have the emotional, the psychological stress that they had to go through. They weren't even sure whether the quiz would come on or not. So I'm sure at a point in time everybody relaxed. If they had continued with the momentum they had started with, they may have continued with the same high points. But well, I can't say the COVID, it really has affected every one of us. So affecting them, I can't imagine how they actually made it, because they did their best. The students have tried very well, because for a protracted period of not having a face-to-face encounter with your handlers and all that, it's a plus. It's a feather in their cap for them to be here. Yes.
Great. I mean, we can't run away from the fact that for some of the contest, other prelims, level, it can be, maybe I should whisper what I want to say, it can be boring, we can't run away from that. But you sometimes sit through 3 contests. Sometimes when I'm at the back, for some of the contests, I really would want to sleep, What keeps you going in those times when the contest is not as competitive as you would expect, and it gets boring at a point? What do you do to stay awake?
Actually, it pains me when students are not able to answer the questions. I feel like I could do something for them. I think that's what urges me on, because I feel maybe I should read the question in the way that would ginger them to answer. So sometimes you realize I'd have to bring in some funny things. I remember in the Eastern region, I was making fun of Lois because she had a very small voice, and when she talked, you hardly heard her. And I tried mimicking that just to make her come out. And I think it made everybody relax. Sometimes you need such things to make us go through the boring contests. Yes.
But boring is my word, actually.
That's why I put it in quotes.
Okay, so now we are in the Volta region, Volta Uti zone. What should we expect?
I'm expecting very exciting contests. I'm sure they were observing what went on in the Eastern region. They have seen my style, and they would have adapted to my style, and they would give off their best. I wish them all the best. Left to me alone, they would all qualify.
Now, the Vice President, Dr. Mahmoud Bawumia, has commissioned the new liquid bulk terminal at the port of Takoradi in the Western region. Inathale Kwanta has more in this report.
The newly commissioned liquid bulk terminal comes with loading arms of 5 petroleum products and has a berth facility which is designed to support up to 60,000 petroleum cargo carriers. It is expected to provide about 50% of the country's domestic oil consumption and enhance the transshipment of petroleum products to other countries. Partnered by IBSTEC, a wholly Ghanaian entity, with the Ghana Ports and Harbour Authority, the Takoradi Port Expansion Project has been transformed into a world-class marine facility. Dr. Bawumia, at the commissioning of the facility, said the indigenous company, IBSTEC, was quite ambitious of the project, but the President trusted in their spirit and might to make this a reality.
The new liquid bulk terminal that we are commissioning today is expected to serve the western, middle belt and northern parts of the country, including transit petroleum products to our neighboring countries. It is gratifying to note that the liquid bulk terminal, with a draft of 14 meters, becomes the leading petroleum products berth in Ghana and can handle bulk fuel carrier vessels of 60,000 ton weight. It is also important to note, ladies and gentlemen, that the liquid bulk jetty was financed fully with private funds by IBSTEC, the Ghanaian developer and operator of the Takoradi Port Multipurpose Container Terminal. And this is a demonstration of the partnership between government and the private sector, and we wish again to commend IBSTEC for this initiative.
Board Chair of the Ghana Ports and Harbour Authority, Peter McMahon, stressed that the commissioning facility is testament to their commitment to fast-track the development of the port and in line with the national development goals.
The liquid bulk terminal consists of 14-meter depth berth, the deepest in-harbour berth in Ghana at the moment, yes, deeper than that of thermal oil berth, loading arms for 5 petroleum products, which are petrol, diesel, LPG gas, bitumen, and other heavy fuels. Full berthing structures, including fenders on dolphins, bowlers, and hooking points. The berth facility is designed to support vessels up to 60,000 tons of petroleum cargo carriers. We will need 2 or 3 of the current tank farm customers to share one of such cargo volumes. As part of the terminal, we have also developed a header station where all the pipes terminate so that importers can tie in to receive their various cargoes. By this new terminal, in fact, more than 50% of Ghana's domestic petroleum consumption demands can be met with ease. These projects make up only a part of the major development vision of the Port of Takoradi, as we intend to connect the Sekondi Bay and create one of the largest marine industrial enclaves for Ghana and West Africa.
Adding to the infrastructure at the Port of Takoradi, the Vice President cut short for the Phase 2 of the construction of the dry bulk terminal, which is Christian the Atlantic Terminal Limited, with an operational capacity of just 6.5 million metric tons per annum for bulk cargo. This facility will bring to a total the capacity of the port to handle about 18.5 million metric tons each year.
And that's it by way of business. Sports is up next.
Welcome to the sports segment on News Desk. And it's your election headquarters, some 81 days to the election. So when we get to this point, you know that Almost every segment will have an election-related matter. This time round, we are starting from sports, and George calls it your election sports quarters.
Yeah.
We'll start off with a promise from the NDC. George, fill us in with the details.
Yes, so the People's Manifesto. We've been reading a lot from it, and the sports part. There's one key thing they've said, that they're going to be supporting Premier League clubs to help them settle salaries. The NDC is looking at giving each player 1,500 Ghana cedis.
I think we produced an artwork of that.
Yes, we produced an artwork, and that's going to be like an average to help the clubs deal with it. And it's good that the two political parties, the strongest political parties, have gotten in this debate. We are opening it up. We're starting this way. We would have them come together and do everything, but we're starting this way. That's the Joy Sports flyer we put out there. And you can see NDC will establish a sports development fund. Every club that plays in the Premier League will be supported with funds to settle player salaries, an average of 1,500 Ghana cedis per player. Gabi,
how many clubs do we have roughly?
Oh, if you say every club
in the league,
in the Premier League we have 18.
Okay.
In Division 1 we have 48. In Division 2 we have over
okay, but let's
100.
stick to the Premier League because that's what it says.
So Premier League clubs.
There's a response from Gabi
Asari Ochodako, special aide to the president,
NPP.
a member of the National Patriotic Party, NPP.
New Patriotic Party.
New Patriotic Party, I must say. So this is what we got. A world first, professional footballers to be added to government payroll in case John Mahama wins. I hope the mathematicians are adding up the costs to you, the taxpayers. The truth is, you and I know they don't mean it. So this is the response from Sami Jemfi, but I wanted us to see Gabi Ochodako's own first. This is Sami Jemfi's response.
Okay.
Let's have a look at
the first artwork.
The first artwork with Gabi Asari Ochodako. Now, he took them up there on Twitter. Yes. And you see that on your screens, and then you get the reply from Sami Jemfi. But it's been interesting how this.
So this is what happens. The NDC makes a promise.
Yes.
Gabi Ochodako says, "Wow, this is the first time in the world where governments are adding professional footballers to their
feels like it's a reverse of free SHS now, because now it looks like in football we're having our own free SHS being promised by the NDC. We're going to interrogate this.
But Sami Jemfi responded to Mr. Ochodako's comment.
Interesting one.
What did he say?
Long one. The thesis is long. Just trying to say it is very, very possible. Justifying why they have made a strong point. So this is up for discussion. And on News Desk, we're only giving you a taste of it. We'll continue on Sports Today and polls. Yes, on Sports Today at 2, on polls later at 4:45.
3:45?
I mean, no, the poll starts at 4:45, yes. And then we'll continue with the rest. Of course, we'll make sure we give the two the platform to come and talk about this well. We'll go through all the way, the week's sports review, sports league. Let's try and see if it makes sense. Because remember, the clubs are already happy about this. So if you're going to give us an average of 1,500 cedis per player, that's good news. This will be the first time a government will be doing this if it does happen. The NPP are saying that, are you sure about what you're doing? So let's have a debate. Let's have a fantastic one. And this is just where we start from it. So you can keep following our social media accounts on Twitter at Joy Sports GH, on Instagram at Joy Sports GH as well. You have to follow my Joy Online. We have great sports stories out there, including Juju preventing some Ghanaian players from joining the Black Stars. So much to read.
I saw that article. It was shared on our social media platforms. So quite an interesting one. But thank you so much, George, for the sports update. And that's how we end this edition of News Desk with me, Bernice Abubedulan. So there's more news when you log on to myjoyonline.com. Do stay with us here on your election headquarters. We've got great election-related content for you. And definitely throughout the day, we'll bring you some other stories. From the entire team, we wish you the very best of the day. Take care.